Hello, and welcome to this session on mental health in school-aged children. My name is Shannon Gosson. I'm a public health nurse completing a master's degree in nursing education. I will be your host today and will be joined by the nurses of Marshall Public Schools during this presentation. Let's get started. According to the Minnesota Department of Health, the burden of poor mental health has significant implications. Poor mental health is a risk factor for developing mental illness, contributes to illness, missed school and work, disability, or premature death. Poor mental health is a risk factor for developing various chronic disease, increases the need for health care, and can lead to physical inactivity, injury, crime, smoking, drug and alcohol abuse, and suicide ideation or attempts. Let's take a look at this video and listen to some personal stories about breaking the stigma regarding children's mental health and creating change.
You kind of have a roadmap of like what it's going to be like, in your life. All of that all of a sudden came into question.
I think I was pretty numb. I think my husband was kind of in denial.
We haven't told a lot of people about Jack because we're so worried about the stigma.
We don't socialize, and that's one thing that's kind of sad, that she's never had a birthday party at home. It just seemed like it was taking over our lives.
I was shooting heroin every day. I was doing it behind my mom's back, my family's back. That summer there should have been a dozen times where I should be dead.
One of the things I really thought about when I was feeling suicidal and things were like, what would Owen do without a big sister?
To see her cutting herself and just wanting to hurt herself, yeah, it's really hard to find the words to explain.
When I woke up that morning, I had a text message from him that said, "Hey, I love you." I texted him and said, "You are my boy. I love you too." I don't know if he ever got that text message or not. I remember just yelling, "No, no, 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 no." I didn't think anybody could live with that level of pain.
I think a lot of people feel that mental illnesses are something we make up in our minds.
It's not necessarily that something's wrong with the child, it's that they're living a battle inside that is like so much bigger than anyone can imagine.
A lot of people don't know much about autism.
People think they're dumb and that they can't do things other kids can, and he will.
I think that old saying, "It takes a village," rings true.
We all add value to this process, and as we all work together, that's when we can make the most powerful difference.
As of 2019, in the United States, 50% of the U.S. adolescents, young adults, and adults have poor mental health and no current mental illness, whereas 40% of U.S. adolescents ages 12 to 18 do not have optimal mental health. These are astounding numbers, and this data is prior to COVID-19. Truly, it does take a village to impact the lives of youth in America, and schools play an integral part of that village. Educators are often the first to notice mental health problems. The challenges and problems on the mental health front have become urgent enough that a focus on mental health promotion in children and adolescents must become part of the regular school day, and this is just as important as the more traditional educational learning that takes place in our schools. In a perfect world, educators and school staff would always see and work with students that were healthy and in a state of well-being. What it means to be healthy varies from person to person. According to the World Health Organization, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or illness. Now I'm going to turn to our school nurse experts for some additional information. Danielle Brandt, Marshall Middle School nurse, will share some characteristics of a healthy well-being.
Healthy students have a positive affect, meaning they are cheerful, in good spirits, happy, peaceful, satisfied, full of life, have positive relationships in their lives, experience personal growth and self-acceptance. These students also feel they have a purpose in life. They can contribute to their community and can cope with the normal stresses of life.
Thank you, Danielle. Now that we have an idea of what mental health looks like, let's take a look at how it compares to mental illness in this video.
When you hear the phrase mental health, what do you think about? Chances are the first things that pop into your mind are depression, anxiety, ADHD, PTSD, and so on. So often, when we hear the phrase mental health, we immediately think mental illness. The diagnoses, labels, pills, and therapies that are meant to treat disorders of the brain. In our society, the two terms are often used interchangeably, or they're considered opposites of one another, like two ends of the same spectrum, like this. This representation suggests that if you're not mentally ill, then you must be mentally healthy. Yet, by definition, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So, mental health is not the same as mental illness, nor is it the opposite of mental illness, as this graph might suggest. There's more to experiencing physical, mental, and social well-being than not being mentally ill. So then, what is mental health? Let's consider the idea that we all have a state of mental health that changes across our lifetimes, despite the presence or absence of mental illness. Mental health is continually affected by many different factors: genetics, relationships, family, physical health, communities, and even government policies. Your mental health ebbs and flows based on the interaction of all these factors. The more these interactions add up to positive influences, the more likely you'll experience what we call optimal mental health. Optimal mental health is reflected in productive activities, fulfilling relationships with others, and the ability to adapt to change and cope with adversity. Conversely, we can experience poor mental health when the interactions of our genes, relationships, communities, and so on add up to negative influences. In these situations, we might experience less productive activities, unfulfilling or unhealthy relationships with others, and challenges in adapting to change and coping with adversity. Because mental health changes across the lifespan and exists despite the presence or absence of mental illness, a clearer way to think about mental health is to consider two dimensions. This model suggests that mental health and mental illness are not opposites on the same spectrum, but rather related and interactive states. For example, a person can experience anywhere from serious mental illness to no symptoms of mental illness. And at the same time, that same person can also experience anywhere from poor mental health to optimal mental health. Let's consider some examples. This is Carly. She was diagnosed with ADHD when she was 7 years old, when her struggles in school became overwhelming, and her parents and teachers sought a formal diagnosis in an effort to help her succeed. Carly began receiving therapy from a well-trained clinician. She attended a school with a curriculum that emphasized relationship building and received lots of support from her parents. With effort, Carly was able to excel in her classes in middle school and high school, and now is headed off to her dream college. The road wasn't always easy, but even with her diagnosis, Carly thrived and learned how to cope effectively with challenges and adversity. Carly shows us that having a diagnosis does not make it impossible to also have optimal mental health. This is Emilio. His parents have just divorced, and he feels sad, unproductive, and disconnected from others. His mother takes him to the pediatrician, who gives him a thorough assessment, but determines that Emilio doesn't meet the criteria for clinical depression. She does give him a book about a boy experiencing divorce, and this helps Emilio understand his feelings. Emilio's parents participate in a program for divorcing families. He's able to join an after-school program that promotes social skills, and he starts to feel better the more he reconnects with people, and soon Emilio feels like his old self again.
Emilio shows us that having no diagnosis does not guarantee good functioning.
So with so many factors at play, what does this mean for understanding the mental health of families and children? Using a public health approach helps put these factors in perspective.
Public health is concerned with whole populations of people. Successful population-based public health campaigns have focused on reducing smoking, encouraging prenatal care, and eating healthy foods. These campaigns have led to sweeping changes and improved health within entire populations of people.
We can approach mental health in a similar way by working toward optimal health for everyone, not only those who are ill.
Public health also emphasizes creating healthy environments. Programs that create smoke-free spaces and eliminate food deserts change the environment, which then changes the behaviors of the people who live there. Finally, public health approaches encourage health promotion before illness occurs. Promoting mental health can happen in home visits to new parents, high-quality early childhood programs, and healthy youth activities that build self-esteem.
These programs help people have more control over their lives, including their mental health.
You can use a public health approach to become involved in promoting children's mental health by working with children to improve their self-esteem, communication skills, and ability to regulate their emotions, engaging parents in healthy parenting practices, conflict resolution, and learning about child development, incorporating mental health promotion activities into our schools, social service agencies, and other organizations serving children and families, changing policies so that children have secure housing, healthy foods, safe neighborhoods, and access to health care, and reducing stigma about mental health and mental illness. You can find more information about public health approaches to children's mental health by following the links in the description section, or visit the Extension Children, Youth, and Family Consortium's website for more information about our work related to children's mental health.
And as always, thanks for all you do for children and families.
The World Health Organization says the goal is to reduce the burden associated with mental disorders. Prevention of mental disorders and promotion of mental health is a priority health project of the department. In the school setting, educators can create and empower students to possess a healthy social-emotional lifestyle, regardless of age. We will take a more in-depth look at the role of prevention, promotion, and identification within the Marshall School District. Mental health prevention. What is it? Mental health prevention is concerned with preventing disease. You may notice there seems to be some overlapping between prevention and promotion. The two approaches may sometimes involve similar activities, but produce different outcomes. For example, a mental health promotion intervention that is aimed at increasing well-being in a community may also have the effect of decreasing the incidence of mental disorders. Deb Herman, Marshall High School nurse, will share some examples of programs that our students and families have access to through the school and community that help prevent mental health disorders.
For teen pregnant moms, referral to prenatal care and a provider, home visiting programs for teen pregnancy and moms, public health visiting, WIC programs, Supporting Hands Nurse Family Partnership, Planned Parenthood and Birthright, parenting skills training, ECFE, early childhood programs, Head Start, classroom curriculum to prevent substance abuse, aggressive behavior, or unprotected intercourse. Safe to Speak is a program to anonymously report concerns. It's for bullying, fighting, chemical use, or any concerning issue. Military Kids curriculum for deployed military members. Community services in the Marshall area-wide classes and opportunities, youth sports, activities, classes, and any after-school program. Depression prevention, Greater Minnesota School-Based Counseling, and Born to Be Alive, Yellow Ribbon, a student-driven program, health class curriculum, lifelines education to students, how to help a friend ask regarding suicide, Spectrum, sexuality, pride, education, community, truth, respect, unity, morality. Southwest Health and Human Services has many programs for health and mental health services. We refer to working with medical providers at the clinics in the area, as well as behavioral health units. COPE program, creating opportunities for personal enrichment. Prairie Home Hospice and their grief programs.
Thank you, Deb. Mental health promotion encourages and increases protective factors and healthy behaviors that prevent mental disorders or reduce risk factors that may lead to mental illness. Health promotion improves health and well-being. Deb is now going to share some examples of programs that help promote mental health.
Preschool psychosocial activities such as ECFE, school-based programs targeted for vulnerable populations, Greater Minnesota Families, and any counseling group, violence prevention programs such as SMART and RAP, youth development programs that sponsor community relationships, any park and rec program or YMCA program, all our school clubs, Born to be Alive Yellow Ribbon, Spectrum, martial acts, sports teams, youth development programs that foster positive relationships, church youth groups, Boy Scouts, Girl Scouts, and other community clubs.
Thanks again, Deb. Everyone deserves the opportunity for well-being. Research tells us that where students live, learn, work, and play will impact their mental health and well-being. The development of resilience, or mental toughness, and the ability to bounce back after tough times is often emphasized when discussing mental health concerns. However, resilience is not enough in the face of oppression. Therefore, system changes that are intentional and essential to help students thrive. The structural drivers that promote positive mental health include the community, people, places, or the environment, and an equitable opportunity for all. The environment and relationships that educators create within the confines of a classroom promote mental well-being and prevention of mental illness disorders. Positive relationships are central to mental health and well-being, and these relationships provide meaning, facilitate skill development, and feelings of belonging. Students need to learn how to manage stress, find balance and focus, and engage socially within their environments. Kathy Becker, Westside School Nurse, is going to elaborate on specific things that staff and educators can do.
Educators and school staff can support the mental health of all students in your classroom and school, not just individual students who may exhibit behavioral issues. Consider the following actions. Promote social and emotional competency and build communication skills of students when they are struggling with difficult times. Help ensure a positive, safe school environment within your classroom and throughout the school. Teach and reinforce positive behaviors in decision making. Encourage helping others. Encourage good physical health. Help ensure access to school-based mental health support utilizing our school health offices, school counselors, and school social workers. Marshall School District also promotes the use of mental health accommodations that allow students 15-minute breaks. This can look different for each student and age. Some students can recognize that they need a break, but staff might need to suggest or offer a break for other students. We can offer such things as calming apps, iPads, or a timeout.
Thank you, Kathy. Because of their countless interactions with students, it's vital that teachers know how to promote a classroom environment that promotes well-being. Educators should also be able to identify students showing signs or symptoms of mental illness and refer appropriately. Let's identify some warning signs of mental illness. Kathy will now share some signs or symptoms staff may see in students that may be having mental health concerns and might need some additional follow-up.
Some general warning signs that may indicate poor mental health or mental illness include feeling very sad or withdrawn for more than 2 weeks, seriously trying to harm oneself, cutting or making plans to do so, increased irritability, frequent complaints of physical illness such as headaches or stomach aches, sudden overwhelming fear for no reason, sometimes with a racing heart rate or fast breathing, involvement in many fights or desire to badly hurt others, severe out-of-control behavior that can hurt oneself or others, not eating, throwing up, or using laxatives to make oneself lose weight, intense worries or fears that get in the way of daily activities, extreme difficulty concentrating or staying still that puts the student in physical danger or causes problems in the classroom or throughout the school, repeated use of drugs or alcohol, severe mood swings that cause problems in relationships, drastic changes in the student's behavior or personality, for example, decreased interest in activities that are previously enjoyed.
As Kathy shared, it is important for staff to know and identify early symptoms of mental illness. The referral is integral to assisting the student. However, when and if possible, it is helpful for staff to communicate with the student first. This promotes a connection and therapeutic relationship that can foster trust and improves communication with the entire care team within the district. If a student is not in emergent need of care, teachers can ask permission to refer for additional services and help from either nursing or counseling. The Marshall School District school nurses utilize a feelings checklist. Danielle Brandt will join us again to discuss the checklist.
Our feelings checklist is modified from the depression checklist by SAVE, which is the Suicide Awareness Voices of Education, and used with their permission. It is utilized by us as nursing staff as a quick and simple screening tool to identify symptoms students are experiencing. It also allows staff to assess the frequency and severity of the symptoms experienced by students. For some students and younger students, we often encourage or ask the parents to fill out the form and get their feedback to give us a full picture of the students' needs and concerns.
Thanks, Danielle. After review of the checklist and assessment of the students, nursing or school staff should utilize the Mental Health Risk Assessment Process Map when students have been identified with mental health concerns. By using this process map, nurses and staff can easily determine next steps when caring for students. School nurses also provide referrals to mental health community resources. In the case of an emergency and when students are in imminent danger to themselves or others, emergency medical services are initiated. Some referrals that are utilized include the Suicide Prevention Line, Crisis Text Line, Western Mental Health, National Crisis Line, Avera Marshall Regional Medical Center, and countless mental health counselors. Let's watch a short video that discusses the Crisis Health Line.
Hi, my name is Lindsay. I work at DHS in Communications. As a communications person, I see things for crisis resources all the time, including Crisis Text Line. I've struggled with mental illness for a while now, and a few months ago I did experience my own mental health crisis. I was able to connect with Crisis Text Line. It was really easy. It's a free service and it's available 24/7. With my mental illness, it makes it a little difficult for me to speak. And other crisis resources are great, but Crisis Text Line really enabled me to reach out and get the help that I needed in a way that I was comfortable. My trained crisis counselor that I got with texting Crisis Text Line encouraged me to reach out to my boyfriend for help, and he was able to come and support me. And so I was really grateful that Crisis Text Line was available and that I knew that someone was on the other end listening and ready to help me out. Contacting Crisis Text Line is super easy. All you need to do is text MN to 741-741 to be connected with a trained crisis counselor.
We have touched on the signs and symptoms of students suffering from poor mental health, but it's also important for all school staff to understand the implications of those feelings and the implications of suicide. According to the Minnesota Department of Health, in 2016, suicide was the leading cause of death for Minnesota youth between 10 and 17 years of age. The agonizing grief, fear, and confusion of this tragic loss of life is not limited to the immediate family, but also impacts schools and communities. There is not a single path that leads to suicide. Rather, a combination of factors can increase an individual's risk of suicidal thoughts and behaviors. Some factors include serious mental illness, substance abuse, a painful loss, violence, and social isolation. The 2019 Minnesota Student Survey data is staggering. 24% of 11th graders within the state of Minnesota reported seriously considering suicide at some point in their lives, and nearly 1 in 10 students in the 11th grade reported attempting suicide. For students that are lesbian, gay, bisexual, or transgender, were more likely to consider or attempt suicide. Parkside and high school nurse Gina Webb will share signs and symptoms that someone might have that is at risk for suicide.
Learning the warning signs of suicide are very important and crucial in those who work with teenagers. Warning signs can be organized around the words facts, feelings, actions, changes, threats, and situations. Feelings include hopelessness, helplessness, worthlessness, and anxiety. Actions include drug or alcohol use, aggression, reckless behaviors, doing risky or dangerous things, talking or writing about death. Changes include behaving differently, becoming withdrawn, tired all the time, sleep pattern changes, loss of appetite or overeating, losing interest in friends and hobbies, behavior changes, can't concentrate on school or regular tasks. Threats include students verbalizing wanting to die or kill themselves. If they are stating they have no reason to live or talk about being a burden to others, plans like giving away their favorite things, or even suicide attempts like overdosing or wrist cutting. Situations include getting into trouble at school, home, or with the law, recent loss through death, divorce, or separation, or just changes in life that feel overwhelming to them.
Once these warning signs have been identified, emergent actions are required. Marshall Public Schools utilizes the mental health risk assessment. Gina will now provide a brief description of this assessment and what staff should do if dealing with a student in crisis.
Well, first and foremost, the staff member should stay with the student to ensure safety. The school administrator or principal should be notified. 2 staff members with mental health training should screen the student. The student's parents or guardians are notified. The student is interviewed and assessed. Concerns are discussed with the parent or guardians, and appropriate interventions or support are identified. In this, we have a student safety contract that students sign and agree to not hurting themselves and seek out help in certain ways that they may list. In some situations, we may need to utilize the mobile crisis unit at Western Mental Health to come on site and assess.
We can all learn about suicide prevention, but sometimes there may not be obvious red flags. Staff and educators can do their best to reach out to students and provide support and resources. To assist in suicide prevention, communities and schools need to take a comprehensive approach. This comprehensive approach to suicide prevention in a school includes many strategies, like leading trainings such as these, and developing procedures to identify and assist students at risk, implementing curricula to help students develop life skills and help-seeking behaviors, promoting connectedness and wellness activities, delivering programming to support student academic performance. Our continuing education. The Minnesota Department of Health and the Minnesota Department of Education, along with Cognito, have partnered to bring free online mental health training to Minnesota schools. In this partnership, we can partner with local schools to help build a statewide community of leaders who can support mental and emotional well-being of all students. This training initiative provides free access to Cognito at risk for Minnesota districts and schools. At Risk is a series of 3 online interactive modules. The modules will help educators and other school staff improve their skills, confidence, and willingness to help students in distress. The modules are for staff at elementary, middle, and high school grade levels. Participants will engage in role-playing simulations, interact with virtual students that are showing signs of mental distress, and receive tips from virtual coaches. These modules can typically be completed in 1 hour. Educators should participate in education prevention training requirement per MN statute, as determined by your district. Cognito provides a learning opportunity for staff to identify, approach, and refer students at risk of mental distress by using motivational interviewing and communication skills. So how do you do it? In order for staff to receive the CEUs for this training, they will need to complete an evaluation for this training at the following link for our Microsoft Forms through the district. To receive an additional CEU, staff can register for Cognito Mental Health Awareness training. Staff should go to minnesota.cognito.com and use your official school email address to register. Staff can select elementary, middle, or high school to complete this 1-hour training. I would like to give a big thank you to all the school nurses here at the school, Deb Herman, Gina Webb, Danielle Brandt, Kathy Becker, and Cindy Pfeiffer. And a big shout out to Dan Smith and his crew and his production classes. Thank you. As always, please feel free to contact myself or Deb Herman. We are happy to answer any additional questions or concerns you may have. Thank you.